if you're ready.
All right, Robin, let's hit it.
Okay, you're good to start.
Okay, welcome to the Tuesday, August 24th, 2021 regular meeting of the Board of Supervisors. We will be going into closed session. Madam Clerk, will you read out our two items?
Item number 1. Pursuant to Government Code Section 54956.9 D2, conference with legal counsel, anticipated litigation, significant exposure to litigation, one case. Item number 2, pursuant to Government Code Section 54957.6, conference with County Designated Labor Negotiator Judy Hawkins regarding the following employee organizations: Calaveras Management Union, Calaveras Supervisors Union.
With that, do we have any public comment?
There is no public comment.
Okay, thank you, Madam Clerk. We will adjourn into closed session.
Okay, we're ready to go ahead.
Thank you. Welcome back to the August 24th, 2021 regular meeting of the Calaveras County Board of Supervisors. At this time, would everyone please join me for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And beautiful flag there from our clerk's office. Thank you very much. At this time, I would like to give our board clerk the opportunity to report out on closed session. Thank you.
Closed session from the August 17th, 2021 meeting. Item number 1, pursuant to Government Code Section 54957.6, conference with County Designated Labor Negotiators Judy Hawkins and Shay.
Ms. Glanville, you're unmuted if you...
Thank you. Okay, we're ready now. I apologize for that. For the closed session for the August 17th meeting, 2021, item number 1, pursuant to Government Code Section 54957.6, conference with County Designated Labor Negotiators Judy Hawkins and Shay Johnson regarding the following employee organizations: Service Employees International Union, SEIU, Local 1021 Deputy Sheriff's Association, DSA, Sheriff's Management Union, SMU. There is no reportable action. Item number 2, pursuant to Government Code Section 54957B1, Public Employment, Title, Planning Director, there was no reportable action taken. Report out for today's closed session items. Item number 1, pursuant to Government Code Section 54956.9D2, conference with legal counsel, anticipated litigation, significant exposure to litigation, one case, no reportable action. Item number 2, pursuant to Government Code Section 54957.6, conference with County Designated Labor Negotiator Judy Hawkins regarding the following employee organizations: Calaveras Management Union, Calaveras Supervisors Union, no reportable action taken.
Do we have two items from today? Did you get those?
Yes, I included those as well.
Okay, my apologies, Ms. Glanville. With that, we'll move on to staff announcements. This is a time for county staff to provide updates of upcoming county events that may be of interest to the public. Miss Nancy Giddens.
Thank you. Thank you very much.
How are you doing?
I'm doing well. How are you doing?
We're doing as good as can be.
I'm so glad. I'm really happy to see you today, Nancy Giddens, County Librarian. I wanted just to give you a report of our summer programs this summer. We're really happy with our results. We had 598 children enrolled in our summer reading program this year. That is 137 more than last year. We produced, again, our summer takeaway packets for 5 age groups. 0 to 2, 3 to 5, and then K, kindergarten to 2nd grade, 3rd, 4th grade to 6th grade. So our children learned, for example, the names of animals in sign language. They made rainbows with Skittles. They did an experiment about mold. They created a newspaper. They made asteroids and harmonicas. And the 3 to 5-year-olds used M&Ms to see how, although we look different on the outside, we're all the same on the inside. So it was a great summer of books about reading, coloring your world in various ways. So we were really happy to have so many enrollments. We had 476 of the children participate throughout the program, and 403 participate the majority of the time, so they completed. These are the highest numbers that we've ever had for this, and so it was such a pleasure for us to be involved with the helping to bridge the learning gaps that our children do experience during the summer, and especially for the past 2 summers when schools have been closed or in hybrid learning. We really feel like we've helped families and children do their best. While our summer reading program was going on, we were also doing lunch at the library, giving grab-and-go lunches provided for us by the Amador Unified School District school lunch program in 4 locations this year. We gave them away in San Andreas, West Point, Moke Hill, and also a pop-up distribution place in Railroad Flat. And so over the course of the summer, we gave away 4,077 lunches to our children over the 6 and 8 week summer program that we had. So we're really pleased that we're able to do this. We're so happy with Amador providing this food for us. So many volunteers involved in the distribution of these lunches, and so I feel really happy that we're providing nutritional value to our children as well as informational and intellectual value. So I'm really happy that we were able to help Railroad Flat this summer. We took up 40 lunches a day there and gave them to the children, and there were 30 of the children enrolled in our summer reading program, and every single one of them completed. Every single one of them picked up all 8 weeks of packets. So each one of those kids now has a little 8-book library in their own home. So we're so happy about that. And we're really looking forward to our bookmobile, which will enable us to continue support to that community via our bookmobile. But I do have some news about the bookmobile. We have been affected also by the COVID situation. The factory producing our vehicle shut down during COVID, and when they reopened, it took longer than they had expected to retool their factory, so it's still in production, the original vehicle. After it's produced, then it goes and gets our special library bus doors installed, and then the outfitting of all the shelves and the IT equipment and everything that we'll need to make it a bookmobile. So although we hoped we would get this vehicle in September, it looks now like it will be probably the beginning of December before we get it. But we're actively working on what we will put into that vehicle and how we will deliver the programs that we hope to give to our communities. Railroad Flat being a real focus of our thoughts and our plans, as well as other areas in the county that don't have a branch library. So lots of fun things going on at the library. It's never a dull moment. If you haven't visited us again after we reopen, please do visit the branch that's nearest you. I think you'll find some fun and good things to read and do. Thank you.
Thank you, Ms. Giddens, and we really appreciate all the public outreach through these trying times that you do. So it doesn't go unnoticed. Great job. With that, I would like to ask Lisa Medina.
Good morning, Chair Stopper, respective board members, clerk of the board, and our Calaveras community. Lisa Medina, Environmental Management Agency. Nancy, I would like to come and try your mold experiment and make a Skittles rainbow. Do you still have some left over? Today I have a few announcements. The first one being that Animal Services has several kitties that are ready to go home with you. During our Board of Supervisors meetings, you may have seen some of our flying kitties come up on your computer there. The kitties that are ready to go home to your forever home include Oprah, Twyla, Victor, Ripley, Snowball, Fiona, Cleopatra, and my favorite, Don Juan. I would like to thank Julie Ames and our animal shelter volunteers for putting this slideshow together, and also to share with our community and to share with you folks. My second announcement is for our upcoming free rabies and microchip clinic to be held at Spence Feed and Supply in Angels Camp on Saturday, September 4th from 9 to noon. A huge thank you to Dr. Mike Hayes and our friends of Calaveras Animal Services Focus for making this event happen. We truly appreciate all the time and the effort that you give to our animal services and our staff, animals in our care, and our community. My last announcement, but not the least, is our annual Calaveras County Hazardous Waste Collection event that is scheduled to take place on Saturday, September 11th from 9 to 1 o'clock here at the San Andreas Government Center, and also at a secondary location in Arnold at the Arnold County Road Yard. On Sunday, September 12th, this event will also take place at the West Point Caltrans Yard. Some of the acceptable hazardous wastes include solvents, paints, so go into your garage and your shed and get those cans out, motor oil, antifreeze, pesticides and herbicides, household chemicals, household batteries, fluorescent bulbs, over-the-counter medication like Tylenol, Pepto-Bismol, anything that you think is too old that you might want to get rid of, bring it on down. Small propane tanks, needles and syringes. Those needles and syringes must be in a Sharps container or another approved plastic container. Some of the items that will not be accepted include prescribed medications and or drugs, appliances, electronics, tires, explosives, ammunition, radioactive material, and biological waste. If you have any additional questions, or if you might have something in the back of your mind saying, I wonder if that is something I could bring down, please give our Calaveras County Integrated Waste Management a call, and they will be able to assist you at 209-754-6403. You can also call me at 209-754-6744. Thank you. Have a good day, everybody.
Thank you, Ms. Medina. Ms. Rebecca Turner, do we have an update on our redistricting?
Good morning and good guess. In the next couple of weeks, the county will be hosting several redistricting meetings. Each supervisorial district is required to be adjusted to maintain equal population amongst the districts to ensure fair citizen representation. New 2020 census population data for each supervisorial district has been posted on the redistricting website. To view, you can go to the Calaveras County home page and click on redistricting. This page will continue to be updated as we receive additional data from the state. Join us at the redistricting town halls to get more information on how the supervisorial boundary changes could affect you. Next week, we will be hosting public meetings at the Veterans Hall in Valley Springs on Wednesday, September 1st, and at the courthouse in Copperopolis Town Square on Friday, September 3rd. The following week, there will be a meeting at Ironstone and Murphy's on Wednesday, September 8th, and at the Mount Columby Town Hall on Thursday, September 9th. Each meeting will begin at 6 p.m. You can find the agendas for the meetings on the Board of Supervisors webpage. That's all I got.
Thank you, Ms. Turner. Much appreciated. It's good to have that information in hand. We've been waiting on it for quite some time. With that, are there any other staff announcements that need to be made that I have missed?
There are no other staff announcements.
Excellent. Thank you very much. With that, we'll move on to the public health update. Number 3 is the informational item, administrative office. Receive an update presentation from staff on COVID-19. 2, provide direction to staff regarding the frequency of future COVID-19 updates to the board. 3, provide direction to staff regarding how to conduct future board meetings in light of recent developments with COVID-19. And 4, provide direction to staff regarding whether to hold the upcoming town halls regarding redistricting via Zoom. Staff?
Hi, Krista Von Lotto from the Administrative Office. Thank you, Chair Stopper. Good morning, members of the board. I will turn it over to Health and Human Services to receive the COVID-19 update.
Ms. Allen?
Good morning, Chair Stopper, members of the board. Corey Allen, your Health and Human Services Agency Director. I'm here today with Mr. Doug Archer with Dignity Health, and we also have Michael Magana with our Public Health Division. Dr. Ramirez is also available, and what we would like to do is give you some generic highlights. First, COVID-19 by the numbers. I want to confirm first that you can all see the presentation. Am I seeing that? Thank you. Our total confirmed cases as of yesterday at 4 p.m. is 2,660 COVID-19 cases. Active cases is 97. You can imagine that's quite a workload and an impact on our community. We have 1 individual hospitalized. We have administered 41,000 vaccines, and we've conducted almost 53,000 COVID-19 tests. We are holding steady at 61 COVID-19 deaths. The percentage of eligible population that is currently fully vaccinated is 47.5%. What is important to remind you and our community is that this Delta variant is so much more aggressive than the initial and any other variant that has preceded it. It spreads more easily and more quickly. It may cause more serious illness, and it is most serious for those who are not vaccinated. One way that we can help get ahead of that is to continue to wear a mask. We in Health and Human Services understand that we're growing weary, but right now is critical time to continue to do these things that will help us to limit spread. Stay home and call a doctor if you think you might have been infected with COVID-19 or if you have symptoms. And if you test positive, contact your doctor to find out next steps. It's so important that we protect ourselves and our community. If you are not vaccinated, one thing that you can do is to get vaccinated. Get tested and wear a mask. I want to acknowledge that 2 days ago, the Food and Drug Administration did approve one of our vaccines as an approved vaccine, and I know so many people have been waiting for that transition. That is the Pfizer vaccine. Hopefully that will really prompt individuals to make that step. We want to let you know about your testing opportunities. This week we're going to do a full day on Wednesday, the 25th, so that'll be tomorrow at the San Andreas Library, 1 to 4 p.m. in the afternoon and 9 to 12 in the morning. You can make an appointment online. You can make a phone call, 754-6460, and yes, walk-ins will be accepted. Our Optum Serve testing sites on both sides of our community in Sonora, they have shifted back to Meadowwood Fairgrounds. They are there from 7 to 7 daily. You can make appointments. I believe they will also see you if you walk in. I was just there. There was no line. It was very readily accessible. The Amador testing site, Monday, Wednesday, and Saturday, all day from 7 to 7 at the rear entrance of the Health and Human Services Agency. We will be expanding COVID-19 testing through our mobile vaccination van. The only delay is coming from the contract process with the state, but that is something we are most diligently working on. I want to shift now for the rest of the presentation to hear from Mr. Magana, and we will then be supported by, as I've mentioned, Mr. Archer and Dr. Ramirez. Michael?
Good morning, board. Michael Magana, a health education program manager for Calaveras Public Health. So I wanted to talk to you about what we currently have. The CDC recommends booster shots of the mRNA COVID-19 vaccine to those with weakened immune systems. The U.S. health officials also plan to offer COVID-19 booster shots to all starting on 9/20. The CDC recommends that people who have moderately to severely weakened immune systems should receive a dose of the mRNA COVID-19 vaccine after the initial 2 doses. This includes Pfizer or Moderna. Immunocompromised just means that people have weakened immune systems. They include people who have been receiving active cancer treatment for tumors or cancer of the blood, those who have received an organ transplant or taking medication that suppresses the immune system, those who have advanced or untreated HIV infection, those who are taking things like corticosteroids or other drugs that may suppress their immune system. People should talk to their healthcare provider about their medical condition and whether getting an additional dose is appropriate for them. The U.S. Department of Health and Human Services cited waning immunity as a reason to offer COVID-19 boosters to all people. But that, again, is coming next month, September 20th. For boosters, they are available to those who are immunocompromised. So patients who do have that condition and have spoken to their medical provider can go on myturn.ca.gov to actually schedule their appointment. The next thing I want to discuss are the vaccines themselves. COVID-19 vaccines are effective, including the Delta variant, as we've heard Corey talk about. We know that the Delta variant is more contagious. It's more than 2 times as contagious as previous variants. Some of the data suggests that it may cause more severe illness in unvaccinated persons. Unvaccinated people, again, continue to be the greatest concern for us. We encourage vaccination. Unvaccinated people are more likely to be hospitalized than fully vaccinated people for severe illness. And fully vaccinated people, although they can get the breakthrough infection from the Delta variant, can spread the virus, but appear to be infectious for less time than unvaccinated people. So what do we do with that? We encourage people to get vaccinated. COVID-19 vaccines can help protect you from COVID-19. People should get the vaccine as soon as possible, as soon as it's available to them. People can continue to go to the myturn.ca.gov website to find walk-in or clinic information as well as appointments. And we have a list of mobile vaccination clinics that are happening this month throughout the county. So there's a list of them that are happening throughout San Andreas, Angels Camp, Arnold, Murphys, and Moke Hill. This is just a list of additional resources that are available that people can go to. They can go to the Calaveras County COVID-19 website for information about COVID-19 vaccinations. We encourage people to go to myturn.ca.gov to find the latest information about vaccine appointments, as well as the different testing sites that are available to folks so that they can get tested if they have any questions regarding COVID-19.
So with that, we want to make sure we give Mr. Archer an opportunity to please talk with us about how we're doing in our hospital setting.
All right, thank you, Corey. Good morning, everybody. So we've definitely picked up across the board. Our census as of this morning was 16, with 5 of those being COVID positive patients. Of the 5 COVID positive, we have 2 in the ICU and 3 in our general med-surg unit. Definitely uptick in ER visits in general, but also COVID related. Some for testing and some for symptomatic. We've been staffing wise, we've been pretty tight. We do have some more staff coming towards the end of this week and even more coming next week. A couple of actual permanent hires, but then also a couple of travelers, registry type staff to help us out. we currently, let's see, yesterday we were really busy. We had 6 discharges and we admitted 7. That's a pretty busy day for us. At one point, we were holding some admits in the ER due to the impact of everybody in the valley. Most of the hospitals, in fact, we had one patient that we were attempting to transfer, and we couldn't find a receiving facility for quite a while. So just indication of kind of what's going on in the valley, Sacramento, San Joaquin, down in Stanislaus County. Hospitals are busy, and they're definitely feeling the impact of COVID again. Those are really the highlights. In terms of the vaccine situation and staffing, we're holding our own for now. We're working through some of our processes on exemptions and things like that. So I don't have any updates at this point with the looming September 30th deadline for vaccine mandate. Keep you posted there. And I think those are the highlights, unless there's some questions.
Thank you, Doug. And maybe we hear from Dr. Ramirez, and then all the questions can come.
Good morning, Calaveras County. As Corey stated, the FDA did grant full approval for Pfizer's 2-shot series of the COVID vaccine. So I want to encourage everybody that has not yet received their vaccine to consider that as one of the options. Just remember, we have Moderna, Johnson & Johnson, and Pfizer. And you guys were all given the websites where anybody can find out the information where to get those. The vaccines, again, I just want to reiterate, are effective. Now, they might not be 100% in terms of definitely preventing the disease, but what we do know and what we do see is that the people who are vaccinated against COVID do much better than the people who are unvaccinated. So please, please protect yourself and help protect your community. The state is in kind of a crisis mode right now with hospitals and emergency rooms filling up throughout the state on a daily basis. I'm in contact with multiple different hospitals, and hospitals throughout the state in contact with us in terms of trying to shuffle patients around. I don't know if anybody's paid attention to the news down here in the valley at Kulia Delta earlier last week, running out of space to move their patients. There's even talk about moving patients sometimes out of state and just trying to find a spot for the patients who don't have any room in the hospital to be able to be admitted to. So please don't subject yourself or your family members to these risks, which can be minimized with safe and effective practices such as masking, getting the vaccine, and social distancing.
And with that, what we do is open to questions and then transition back to our CAO to continue with our presentation.
Thank you, Miss Allen. Thank you, Dr. Ramirez. Thank you, Mr. Magana, and thank you, Mr. Archer. With that, we also have public comment. I'd like to give the opportunity for public to pose any questions quickly, and then I will bring it back to the board for direction to staff.
I do not see any public comments at this time.
Thank you, Madam Clerk. With that, I'll bring it back. Board members, do we have any questions immediately for public health?
I have questions.
Thank you, Ms. Callaway.
Dr. Ramirez, in September 20 for shots for all, what does that mean? Does that mean anyone, even if they're not immune compromised, can get a booster, and at what time frame from their last inoculation? I'll just give my questions. That one's for Dr. Ramirez. The second is maybe for Ms. Allen. The chart you showed one in the hospital. Is that one in Mark Twain or one in any hospital in California that's a Calaveras resident. And Mr. Archer said there were 2 in ICU and 3 in med. So that's 5, and our chart shows 1. So I didn't know if maybe I misunderstood. Excuse me. And the third one is, will the mobile vaccination clinic also be able to do the testing? So I could get a shot and I could get tested at the same time, or at least getting people tested even if they won't take a shot. Thank you. Those are my questions.
All right, why don't I take the first, your second and third, and then I'll transition to your first question from Dr. Ramirez. So when we talk about the data that the California Department of Public Health puts forward, that is data that has gone through full vetting to determine the accuracy of the count. So it's usually on a delay, I would say about 2 weeks or so. So when you have the good benefit of hearing directly from Mr. Archer, you're getting real-time information that he is able to provide. So you'll always have a little bit of a difference. Yesterday, our data dashboard showed 3 hospitalized. Today, it shows 1. So that will change because that data that we present on the dashboard is qualified by the California Department of Public Health. Your second question, and the question had to do with which hospital. The dashboard will reflect any Calaveras County resident in a hospital. So it won't necessarily be our local site. The mobile vaccination van, we are working diligently with the state. They were supposed to provide it over a month and a half ago, and now we're holding the requirement over the state to say, we will not take the cost on of this until you honor that promise that you will add testing to the VAX site. We agree with you. It's an incredible opportunity to take care of 2 things at once, and we are simply waiting on them to oblige.
And then to answer the question regarding the shots for all on the September 20th date. So the September 20th date is the target date for when the booster shots should be available to all Americans, with the intention of providing a booster shot for people who have been at or more than 8 months since their second shot in their shot series. Currently, booster shots are available to patients who are high risk or immunocompromised. And as always, if there's any questions regarding whether or not you're eligible, I would highly recommend that any person consult with their physician. To try to use an analogy for the importance of booster shots, I like to refer to the analogy of sunscreen. So whenever somebody goes out into the sun, we all know that sunscreen helps to protect us from skin cancer and getting sunburn. But you always need to reapply sunscreen because sunscreen even itself is not 100% effective. So the same analogy would apply for the booster shot series. So for any vaccine that you receive, that initial shot is going to have a potency associated with it for your body to make antibodies. And over time, our body's antibodies start to dwindle slightly. So the intent with a booster shot is to help bring the antibodies back up and give your body a boost, so to say, with a renewed protection level. I hope that answers your question.
Piggyback on that, Dr. Ramirez, if you had a Pfizer, should you get the same shot 8 months later that you got 8 months prior?
You should stick with the same vaccine that you received. If you didn't, it wouldn't be considered booster because a boost implies a boost from what you have already received.
Okay, thank you.
To follow up on that, Mr. Ramirez, or Dr. Ramirez, my apologies. Maria's got a good question there. Let's say someone gets the J&J shot and it's not currently approved for a booster shot. Would someone be okay to move on to a different type of vaccine, or is there issues with that potentially?
That is definitely a question that's being posed throughout the state amongst my circle of colleagues and worldwide. As it stands right now, again, a booster is with the intent of receiving a boost of a vaccine that you've already received. Should you wish to switch over to a different vaccine, that would be something that I would highly encourage one to discuss with their physician.
Thank you, Dr. Ramirez. Any further questions by board members?
May I?
With that, Ms. Corey Allen.
Thank you, Chair Stopper. I do want to correct two of the statements that I made slightly. One is, I've just been advised that the hospitalizations, when we track them, are our local hospitalizations. I apologize for that. Knowing that we do track our residents when it comes to COVID-19, I misspoke. It really is important that we capture local impact of hospitalizations, and that is why the data is focused, Supervisor Callaway, on local hospitalizations. And the data delay on a hospitalization is only 1 or 2 days. The fatality is what takes probably closer to 2 weeks. So I misspoke on both of those, and hopefully that correction helps.
So Tuolumne's had a huge influx of patients in their hospital. And no offense, Mr. Archer, many Calaveras residents do go to the hospital in Tuolumne. So there could be a strong likelihood that they're hospitalized patients in Tuolumne or in Kaiser or in Sutter. So it's sort of misleading in terms of the number of Calaveras patients in hospitals. So that's just, if there was a way that could be changed, that would be nice. Thank
Any further board questions? If not, I'll send it over to Ms. Von Lotta to lead us through our directional questions that are being posed at this time. Ms. Von Lotta.
Great. So the second item for discussion, as we just received the public health update, as your board will note, it's been some time since we've received one, and the question before you now is, do you have an idea of how often you would like to receive these updates? As you'll recall, at one point we were doing it with every second, third, and fourth Tuesday of the month at those regular and special meetings. It doesn't need to be necessarily that we go back to that, but we could go back to a monthly public health update. And really just want to hear the board discussion direction there. Obviously, or I hope it's obvious that if something truly material were to change, staff would recognize the need to bring it to your board in any event, regardless of the guidance and direction that is given here today.
I'll start off. I'm comfortable with letting public health maintain the ability to bring stuff forward as it progresses, especially with the small part of adding in, if there's substantial change or something that is a high event, it's to be brought before us in a very timely manner. Can we have another board member give their input? Okay, I'll go down the list. Ms. Callaway.
I'm doing an awful lot of chit-chatting today. Something that I thought we had already discussed this a few meetings ago, letting public health and the CAO decide, but things like adding, excuse me, testing to the mobile vans. I mean, that just gives me a heads up. What's going to happen on around September 20, it just lets me know to kind of watch those things. So the comments that Dr. Ramirez made about giving the shots, the mobile vax, what will happen on that. Just a quick reminder of where the mobile van will be. And that might be just something that Miss Allen could just do in 2 or 3 minutes without a big meeting. But I found today's session very interesting. Thank you. So no, I don't think they need to come at every meeting.
So you agree with me, Ms. Calloway? Thank you. Ms. Fullendorf?
Oh, wait a minute. I would concur.
Thank you, Ms. Fullendorf. Mr. Toffanelli?
Yeah, I'm fine with it.
Okay. Mr. Gurman? I'm sorry.
I would like to at least see, that's all right. I'd like to at least see once a month, but if, they decide they want to take longer, that's fine. It's always on the website. We can always click on and see if we want information about how it's going and click on that, and anybody else can too. So,
Thank you, Gary, or Mr. Toffanelli. I agree, and I foresee that there's going to be some events where we'll be seeing more than, or at the very least, once a month at this time. Mr. Garamendi?
I think
at least.
I think once a month is fine, but twice a month might be more, might be better, and especially since we seem to be in a bit of a crisis at the moment, and I think it's kind of like bad news to happy music. We've got a lot going on, so it's just going to put a lot on Corey, that she's going to have to make some judgment calls on what she shares and how often. But I have faith in her, so I'll go along with it.
Thank you, Mr. Garamendi. And Corey, yes, we put you in a tough position. You took the job, so please make the appropriate decisions moving forward. Let's move on to item 2. Ms. Bonlotta, can you lay that down for us?
Sure. So just for the benefit of anyone to whom it's not obvious, you'll all note that this meeting is being conducted 100% via Zoom today. The question before the board now is, how would you like to conduct, logistically speaking, board meetings going forward? So, on one hand, one kind of extreme would be to do it completely open to the public, and as we've been doing it for the last few weeks, where staff and the full board is at the dais. I note that last week we were wearing masks. I recommend that were your board to, and I certainly defer to Dr. Ramirez in public health here, but would recommend moving back to masks to the extent that we have any in-person, hybrid, or other style of board meeting. So that would be on one extreme. The other extreme would be 100% via Zoom, as we're doing today. And then there's more or less a hybrid model that your board is welcome to give staff direction on, where we could do both Zoom, for example, as well as have social distancing in the main board chambers, like we did a few months back, where we would have staff at tables and we could have the supervisors, your board, socially distanced in that way, and also give people the opportunity to continue to Zoom in, including board members. Personally, I think that approach would be a good happy medium, but it is clearly for your board to make that determination. With that, any questions or comments?
I'll start out again. I think as a board member elected to my position, we have a certain responsibility to do it in person. There are certain events, and I will admit that one potential event is one of us getting sick like I did and potentially exposing everyone, so we had to move to the Zoom meeting today. It's unfortunate. At the same time, we need to make a statement. The CDC, the Department of Public Health, and OSHA have given recommendations on how to move forward safely. Vaccinate, mask up. We have all these tools in our pocket. And I think that us showing up as a board, doing business as a board together when it's viable, today is apparently not viable for a very good reason, that we continue conducting business in that fashion with all those safety precautions in place, because we have confidence in those safety precautions moving forward. When it comes to public coming in, I think that's a debate for the board is in its entirety. Things have not changed at the state level, but I think if we do decide to have public come in, which I'm somewhat in support of, they're required to wear a mask and respect social distancing at that time. If they don't respect that situation, they will be asked to leave. And then they can appropriately come in via Zoom without their mask on and attend a meeting through that way when it comes to the public. But that's my position as one. I'll hand it over to you, Ms. Callaway, again, to follow up on that.
Mr. Chair, this is Supervisor Garamendi. I have a quick question.
Mr. Garamendi, please.
Thank you. Dr. Ramirez, you are our public health officer. We pay you for your opinions. I'd like to know your thoughts.
You know, I've said this before. There's 3 ways to help us battle COVID. There's only 3 ways, regardless of how you want to do it. You either separate, isolate, you get the vaccine, you get a mask. These are all ways to decrease transmission. If you don't do these, there will be transmission. It's a very simple answer, but it seems as though the incorporation is not followed simply.
Perhaps you could be more specific. I'm not sure. I guess I'm looking for a go or no go.
I agree with Supervisor Stopper. If you want to bring the public in, they need to adhere to the spacing and they need to adhere to the mask, realizing that that's only part of minimizing transmission. In an ideal situation, everybody would be vaccinated to maximize protection, as mask and distancing only go so far.
So if I could interpret, so if we are vaccinated, we're wearing our mask, we're socially distancing, we can still meet safely and do our job.
I would say the risk would be much more minimized. And I think very many people would feel a lot safer. We'd be setting a good example to the public. It's kind of hard to, you've heard the adage, do as I say, not as I do. And that very much applies to this pandemic. Unfortunately, everybody's trying to make their own rules, to speak quite candidly. But at the end of the day, those 3 options are all that we have on the table, unfortunately. Vaccinate, separate, and mask. And when we don't want to follow that, this is what happens.
Mr. Chair, after hearing from the doctor, I agree with you. I think we ought to have the caveat in place that if one of us is exposed or gets sick, we'll have to adjust or sit out. And we always do have the Zoom option in the room anyway. But I'll go with you on this. Let's do it.
Thank you, Mr. Garamendi, and thank you, Dr. Ramirez, for your input. It's valued. I think we see eye to eye on this. We're setting a strong example by practicing these safety precautions. Ms. Callaway, where do you stand?
We should all be in or all be out.
Okay.
I am happy with Zooming. But if we want to go back.
Oh, you accidentally muted yourself, Marita. Sorry. Can you please?
I'm happy with Zooming. But if we want to go back to the board, does it make us better board members because we're sitting in the boardroom, vaccinated, masked, and 6 feet apart? If that's what our perception is, I'm okay with that.
Thank you, Ms. Callaway. Ms. Fullendorf.
I would concur it's either all in or all out, but we had the opportunities as this situation we're sitting in presented to pivot to a different option as needed. I guess my biggest question is staff safety too, because there's the 5 of us, but we're also around staff, so being mindful of any of their concerns and making sure that they are comfortable letting us know too if there's something we need to know, and not being afraid to keep the safety of not just the staff but ourselves.
Thank you. Very good points, Ms. Fullendorf. And our staff should become number one when we are making this decision and kept in our mind. And I definitely am open to the input of staff as we move forward, and definitely want to keep that dialogue open, and that is part of the consideration as we move forward. Mr. Toffanelli.
I'm in favor of meeting in person. There's always the option of Zoom if you don't want to come. But I think it's our duty to meet in person. That makes it better meeting altogether. And as long as we follow the guidelines that the doctor just said, we mask and we maintain the separation, then we're vaccinated. So I'm assuming we're going to be going back to what we were before. Not all of us at the diocese, that we have the 6 foot separation that he's recommending for our meeting as we go forward. But I'm in favor of going in person.
Yeah, I think it's going to be more of a 3 foot separation with the confines in there, but Gary, it's more of the format that we're in the past. That is why I'm suggesting we put forward. So I'm going to surmise what we just all said, and if anybody disagrees, please let me know. We're going to continue meeting in person as long as all the issues that could come forward permit. If there's a special circumstance, that will change. At this point, we will all be masked. I would ask that every board member is vaccinated or attest to that. And then finally, we all wear masks in the room, and we will accept any input from staff as we move forward how to do it so that we can keep them and their safety in mind as we move forward always. We will keep the public the opportunity to show up in person. The distancing rule applies and the mask rule applies. Right now, I don't see a clear path to validating vaccination, nor do I wish to validate vaccinations when it comes to the public. If these wishes are not complied with, they will be asked to leave, at which time they can attend a meeting through Zoom without their mask and be able to give their input. Is that reasonable? I think so. All right. I think we have our answer there, Ms. Bonlana. Do we have further questions? I think we do.
So the final topic would be similar to the last issue we discussed. As your board knows, we will be conducting redistricting town halls in the first 2 weeks of September. And so the question is, how would you like to conduct those town halls, in person or via Zoom? And I invite our clerk recorder, Ms. Turner, to jump in with any input or additional recommendations she might have regarding what this process can look like.
Okay, yeah. No, I'm gonna go ahead and let Ms. Turner have her moment, and then we'll go from there.
I don't necessarily need a moment. However, we can accommodate either way. Right now, the facilities are booked. We can do signage similar to other public meetings to wear masks, just as you did for the board chambers, or it's easy enough for us also to switch the meetings to be fully virtual. So it's entirely up to the board's preference, but I'm prepared to accommodate either way.
Personally, I'm big on the safety of our staff and how we proceed. This is our biggest consideration. I think a hybrid venue would potentially alleviate a lot of people showing up. At the same time, we will have the same safety standards in place that we're requiring of the public when it comes to them attending the board meetings. With that, I'll pass it on to, I'm going to go ahead and go to you, Ms. Callaway.
I think we can do both. We had a public meeting in Arnold on the Blagan Bridge, and we had in-person and we had Zoom. So we could do both of them. And if the room is large enough, and I leave that to Ms. Turner, because I just asked her which room we were going to do, the one at Ironstone. I mean, they're both big rooms, but one's really big. And I don't anticipate a lot of people, but I like to have it in person with the masking and et cetera. And people can Zoom.
Careful, Ms. Callaway. That's the second time clearly I've heard you agree with me. Mr. Garamendi.
Yeah, I mean, we want to make sure people have access to the meetings and we want to make sure they're comfortable. We're going to need their input as we go through this. So I'm good with hybrid.
Ms. Fullendorf.
Hybrid.
Mr. Toffenelli.
Hybrid's fine with me.
Excellent. I think that sums up the questions, Ms. Bonlata, does it not?
Indeed it does. Thank you all
Okay,
very much.
I'm going to call for a 10-minute break real quick. There's a couple issues that we got to deal with. Thank you. With that, we'll move on to recognitions and acknowledgements. Item 4, proclamation. Health and Human Services Agency. Proclaim the month of September 2021 as Suicide Prevention Awareness Month in the County of Calaveras, recognizing the role of promoting awareness and resources around suicide prevention. Mr. Jack Garamendi, can you please take this one for me?
Certainly. Thank you very much, Mr. Chair, and thank you to all the people from Health and Human Services who are also on here, particularly the behavioral health folks. So it's my honor to read this on behalf, and I'm sure there'll be comments to be made as we move through this. So I'm here to read a proclamation to proclaim the month of September 2021 as Suicide Prevention Awareness Month in County of Calaveras. Whereas September is the National Suicide Prevention Awareness Month, a time in which individuals, organizations, and communities around the country join their voices to amplify the message that suicide can be prevented. And whereas the past year has presented our communities with challenges and led to transitions that, expected or unexpected, welcomed or not, can be unsettling, disorienting, and stressful. And whereas the pandemic has changed our fabric of life and major life changes are environmental risk factors for suicide. And whereas according to the Centers for Disease Control, suicide is the 10th leading cause of death overall in the United States, claiming the lives of more than 48,000 people in 2020, with approximately one death every 11 minutes. And whereas every death by suicide directly impacts family members, friends, loved ones, and by extension, the entire community. And whereas we must encourage relatives, friends, co-workers, and providers to recognize the signs of a problem and guide those in need to appropriate services and support. And whereas the Health and Human Service Agency, Behavioral Health Services, BHS, is committed to raising awareness, providing education and training on suicide prevention, and helping to reduce the stigma associated with suicide and attempted suicide. And BHS will conduct suicide prevention trainings in September using video conferencing technology that teaches participants how to help others at risk of suicide and how to talk about suicide while decreasing the risk of harm. And whereas BHS has operated a warm line to support the mental health needs of the community since the start of COVID-19 pandemic, this warm line can be reached Monday through Friday, 8 a.m. to 5 p.m. at 209-754-6807 or 209-754-2805. And whereas crisis intervention services are available 24 hours a day, 7 days a week by calling 1-800-499-3030 or 209-754-3239. The call will be connected to a crisis counselor who will assist with their mental health needs or refer the call to a crisis worker in the community. Mr. Chair, I'm sure Wendy would like to add to this, and we'll have probably some public comment. Wendy?
Absolutely, Mr. Garamendi. Let's go with Miss Wendy Hall. Thank you very much for being here, Wendy.
Good afternoon, Board Chair and Board Supervisors. Yes, I did want to say thank you for bringing up suicide prevention for the month of September. I also wanted to share that we will be having a training with a guest speaker, David Woods Bartley, on the why of suicide and the how of hope, which is free to the public, and it is via Zoom, and we hope that you can all attend and that this is shared. There's also a TED Talks by David Woods Bartley that you are all welcome to see. We'll be sending out the flyer shortly.
Excellent. Thank you, Ms. Salt.
Thank you.
With that, I think it's time for us to move on to public comment.
There is no public comment on this item.
Okay. I'll bring it back to the board and entertain a motion. It seems, I apologize. We've lost Miss Amanda Follendorf for the moment. It looks like board clerk, do we want to give her the opportunity to come back in, or can we, Miss Sarah Edwards, can we proceed on this issue? Oh, she's back in.
I think she's back in.
Okay, good. Thank you. Okay. I'll bring it back to the board. Do we have a motion?
So move.
Thank you, Ms. Calloway. Do we have a second? I'll second. All those in favor, and I'm going to call roll call, just because we're via Zoom. So, Mr. Toffenelli. Aye. Ms. Calloway.
Aye.
Ms. Follendorf. We'll take, if she cannot talk at this moment, we'll take that as an abstention for the moment. Mr. Garamendi?
Aye.
And I'm an aye. Thank you very much. Mr. Garamendi, can you tie this up?
Thank you very much. Now, therefore, be it proclaimed, the Calaveras County Board of Supervisors proclaims the month of September 2021 as Suicide Prevention Awareness Month in the County of Calaveras, and welcomes community members to take part in suicide prevention trainings and learn about local resources that pertain to suicide prevention. Passed and adopted by this Board of Supervisors, State of California, 24th day of August, 2021. Thank you very much, Mr. Chair.
Thank you very much, Mr. Garvey. And Ms. Wendy Alt, we appreciate all the work you do to these ends. This is very important to our community. It's a sad day when we lose anybody to this type of situation, and you do all the work that helps prevent that. Our hearts go out to you and everyone else that has these issues. With that, I'm gonna go ahead and give it a moment so that we can try to bring our Miss Follendorf back into the fold. So Madam Clerk, is she out?
She is not currently on the meeting.
Okay, we'll see if we can mend the situation. Let's give it 5 minutes real quick.
Yes,
And then, please stay in contact with me on it.
will do.
Thank you. My apologies, board.
Supervisor Follendorf asked that we just go ahead. She's in the meeting now.
Okay, we're back if everyone's ready. Are we still rolling, Robin? Am I able to go?
Yes, please do. Thank you.
Okay, thank you. With that, we'll move on to general public comment. Any item of interest to the public that is within the subject matter jurisdiction of the board and is not posted on the consent or regular agendas may be addressed during the public comment period. California law prohibits the board from taking action on any matter which is not posted on the agenda unless it is determined to be an emergency by the Board of Supervisors. If public comment is completed before the 30-minute allotted time period, the board may immediately move to the next order of business. If public comment is not completed during the allotted time period, it will be continued as the last item of business in order to provide an opportunity for the remainder of comments to be heard. We have one person that's put in for public comment, Mr. Chris McCoy, I believe. Is he still online?
Yes, Chris is
Good
available.
morning, board members.
Okay.
Good morning, board members. My name is Chris
Christina.
McCoy. Can you guys all hear me? Yes.
Yes.
Christina.
My apologies.
No problem. As you all know, my name is Chris McCoy. I am the ADRC coordinator for Area 12 Agency on Aging. Area 12 Agency on Aging and Disability Resources Agency for Independent Living, otherwise known as DRAIL, have partnered to develop an emerging aging and disability resource connection called ADRC of the Motherlode. The emerging ADRC of the Motherlode will create a network of organizations that will engage in person and family-centered planning and provide responsive and comprehensive information about referrals for long-term supports and services. The information received will enable people with disabilities, older adults, and their families to make informed choices regarding the supports needed to live with dignity in their home and be fully included in their communities for as long as possible. Our emerging ADRC of the Motherlode is very excited to announce that we have developed a new online resource directory. That is what is showing on your screen right now. This is a screenshot of the actual page. This online resource directory will provide information on many services and programs available to older adults and people with disabilities in Alpine, Amador, Calaveras, Mariposa, and Tuolumne counties. The website address is at the bottom of that screenshot. You can see it there. It is https://ADRCofthemotherlode.myresourcedirectory.com. The website address is, never mind, back up. We are currently in the designation process with the state of California. Once we are designated as an ADRC, then I would like to return and give all of you a full presentation about our ADRC. I want to thank you for this opportunity.
Thank you, Miss Christina McCoy. We appreciate your time and we appreciate your dedication to our community. With that, are there further public comments?
There are no further public comments.
Thank you very much. With that, we'll move on to our consent agenda. Consent agenda items are expected to be routine and non-controversial. They will be acted upon by the board at one time without discussion. Any board member, staff member, or interested party may request removal of an item from the consent agenda for later discussion. I'm going to let everyone know that we are pulling item 5 on the consent agenda to a later date to be determined. Thank you. With that, are there any other items that board members would like to pull? Are there any other items that staff would like to pull? Are there any items that the public would like to pull?
There's nobody on the line to pull items, no.
Very good, Madam Clerk. Thank you. With that, I'll entertain a motion. The remainder,
I will move items.
Sorry.
I will move the items 6 through 9 on the consent, Mr. Chair.
Thank you very much, Mr. Toffenelli. Do we have a second? Thank you very much, Mr. Garamendi. Mr. Toffenelli? Aye or nay? Aye. I assume so. Ms. Callaway? I look like an aye through your mute.
Aye.
Okay. Aye. Mr. Garamendi?
Aye.
Thank you very much. Ms. Bollendorf, are you able to talk?
Aye.
And I am also an aye. And I'm going to move you to the top of my screen again, Ms. Bollendorf, so I can see you. But that passes unanimously on items 6 through 9. With that, we'll move on to regular agenda. I'm going to let everyone know that this time, and I'm going to double check with Mr. Whalen. We will be removing item number 12 to a later date.
Correct, Mr. Chair.
Okay, so we'll just be doing items 10 and 11 at this time. Item 10, action item, human resources. Review and provide direction to staff on certain elected officials' salaries. Human resources. Ms. Judy Hawkins.
Good morning, Mr. Chair, members of the board. Judy Hawkins, Human Resources and Risk Management. And I am bringing before the board at your request the updated salary review of the district attorney, sheriff, and coroner public administrator. And in looking at the outside agencies, which we've used for other elected officials to review their salaries, we looked at adjacent comparable counties, which is Amador, San Joaquin, Stanislaus, and Tuolumne. We've looked at the comparable counties we use for the Sheriff's Management Unit, which is El Dorado, Amador, Placer, Sutter, Nevada, and Tuolumne. And then we've also looked at those counties that we've compared quite often for SEIU, which is Amador, Fresno, Lake, San Benito, San Joaquin, Sutter, Tehama, Tuolumne, Yolo, and Yuba. And in looking at these counties, we did see that the district attorney, when we look at adjacent counties, is below the average by 19%. The SMU counties, 18 to 21. And that is because several of those counties have ranges for that elected position. And the same with SEIU counties, which were 17 to 21%. The sheriff, when we reviewed, it was 20 to 23% for adjacent counties. And one of the things that I do want to point out, all of our comparable counties for the sheriff, they are sheriff coroners. None were just the position of sheriff. The SMU counties were 23 to 27%, and the SEIU 15 to 19%. And then we did run into some challenges with the coroner public administrator. The only county that has a classification similar to us is Inyo, and that position pays $25,000 annually, which is much less than what we currently pay. I have gone through many resolutions from the past, trying to see how the coroner's salary was set up in the past. It looked like it typically averaged between 45% and 50% of the elected officials, but I could not find anything that officially established that percentage. The position of coroner public administrator is not a full-time position. And then also there is an income from the public administrator side, which I averaged over the past 4 years. It looks like an average of the 4 years would be about $10,000. With that, I also...
I'm sorry, Judy, could you say that number again?
The average over the last 4 years would average out to $10,000.
Thank you.
I also took and looked at, because we do have to also look at how the positions compare internally as well as externally. And so I will, if I can, I will see if I can share this document. And can you see the document that lists out the classifications of all of our appointed and elected officials, and then their rate? So you do see that?
Yes, we can see it.
Okay, thank you. So this is how our positions are ranking with among one another. And so when we look at, we do have our county administrative officer, our district attorney, our county counsel, then our director of public works, our director of health and human services, our sheriff, auditor, controller, assessor, county clerk recorder, treasurer, tax collector, chief building official, director of planning, chief probation officer, board of supervisor chair, county librarian, board of supervisor member, and then our coroner public administrator. And so if we were to make major changes to the district attorney, the sheriff, then it does have impacts on the other positions, which typically your county administrator officer is your top officer in the county. So I am happy to answer any questions that you have.
Board members, Mr. Garamendi, you have your microphone off, or it's not saying that you have to mute yourself.
Judy?
Thank you, Ms. Calloway.
Excuse me, I'm sorry, Mr. Chair. Ms. Hawkins, for the appointed department heads, they're fixed, they're not in a step system, correct?
Correct. And this was something that after we complete the class and comp study, that I will recommend that we do implement ranges, because it does help from keeping a compaction happening. Because when you have appointed positions, and we do have some counties that also have ranges for elected officials, when you have ranges for them as you do other positions, it keeps them from compacting against one another.
Okay. Oh, go ahead, Ms. Calloway. I apologize.
Well, we had kind of made a commitment to the elected, i.e. the DA and the sheriff, that we would look at this and make any adjustments prior to the election period starting. So I think we should honor that commitment. I mean, we
When
can't
was that
put it
commitment
all.
made, Ms. Calloway?
Pardon?
When was that commitment made and by who?
The board. We discussed it when the coroner came to the board meeting, when we were, we had the auditor, assessor, clerk recorders salaries before us. And
We said we would bring it back for discussion, which is happening right now. There's no commitment made to doing anything. This is where this decision comes in.
that wasn't my understanding.
Okay. Well, we do have Mr. Raggio on the line. I'd like to give him an opportunity, and also if the DA or the sheriff would like to give input on this situation. So let's, Mr. Raggio.
Thank you. Can you hear me?
Yes.
Okay. Well, I have to differ with Judy's opinion as far as this being a part-time job, first of all. If indeed we get reelected and so forth, I'm going to have pretty much full-time getting all the records electronically recorded and so on. As far as comparables go, I went to Google when I saw there was no comparisons. I can't think of the name of the site. I think it's ZipRecruiter has a comparison for coroner salaries in the state of California. They range for rank and file employees from 27,000 to 87,000 for rank and file, with a top out at 114,000. So, I definitely think a range is in order. $15 an hour would bring me up and keep me lower than the other department heads as I have been for all these years. I am transitioning out of the mortuary business. My duties there are becoming less and less as time goes on here, and probably out of there in the next year or so. Anyway, I see that we've already had raises instated for the Board of Supervisors, 5-something an hour, and $13 an hour plus for the recorder, the assessor, the treasurer, and the auditor. And, we should have a raise at least equal to them. And as I said, this is a 24-hour-a-day, 7-day-a-week job. So, I don't really see why we couldn't institute the raises as we did for everybody else immediately and go from there. And that's what I've got to say right at the moment.
Thank you, Mr. Raggio. Is the sheriff or the DA online?
Yes, Chair Stoppers, Sheriff DiBasilio. I have a question for Judy. You have the cost on there for the sheriff at $75.37. Does that include the educational incentives? Because that is absolutely not what I'm making at this point in time.
Okay, so I did double check. It does, and I do have it on there that the rate for the position is $71.78. It's $75.37 with your educational incentive, and I did check with the staff to make sure that was in there.
Okay, I'm sorry, I missed the 71. I was looking at the 75.37. So.
And so that is, and it is put on there that is with your educational incentive.
Right. Okay. All right. That's. I just was kind of concerned. I mean, and I've told a couple of board members I'm more about my guys getting a raise than I am however, I did not realize that I was that much lower than surrounding communities. So I'll just leave it at that. Thank you.
Thank you, Mr. DiBasilio. Sheriff. Miss District Attorney Yook, are you there? Yes,
I believe she's in court today, Mr. Stopper. I had talked to her earlier. I don't think she was going to be able to attend unless that's changed. She had a court thing.
That's good. Well, on one hand, that's good news. She's out doing her job.
Yeah.
With that, I'll bring it back to public comment, and then we'll bring it back to the board for deliberation.
I do not have any public comment on this item.
Okay, I'll bring it back to the board for deliberation. You know, I could go down the list of board members from left to right. I'll go ahead and start. I, for one, as in my position, have been opposed to moving forward with any of the elected official salaries until we bring our employees up to par. And that's where I stand today, and I continue to stand. And I think it's only fair to our employees to bring them up. And my worries about compactions or not, I could let any employee make more than me, and then finally get me caught up after we get them caught up. But that's where I stand. That's where I've stayed solid, and that's where I'm at. So this is the way my screen works. I'll work from left to right. Mr. Toffenelli.
Thank you, Mr. Chair. This is a tough decision looking at what the comparisons are to adjacent counties. The SMU and SEIU has so many different counties. I can understand what Kevin is saying. Judy, can you put that screen back up with the comparisons or the salary that they're making now?
Can you see it?
Yes, thank you.
Okay.
Can you zoom in
And
a little bit?
Kevin is saying that he found comparisons, and you're saying that you have no comparables for the coroner, other than the fact that you said you found one county and it was part-time job paying $25 an hour. Is that what you said, or $25,000 a year?
$25,000 annually, because we only look at comparable count or other counties within the 58 counties. We did not use ZipRecruiter. We looked strictly at other counties and how other counties were structured. Because typically ZipRecruiter and those type of things, salary.com, all of those are usually mostly made of private sector. And so I can look at that information, but we did not, because we typically only look at how other counties are structured.
Well, on these numbers that you present to us, a 20% to the sheriff is going to put him all the way up close to county administrator, and the district attorney 20%, which certainly looks like it will be above county administrator. So it does present problems on those two, of having to look at the other salaries that are there. Kevin's salary, I would certainly, him being at the bottom down here, and if it is a full-time job, I'd be open to looking at that, giving a raise to that position.
And I can work, so I do think, since we are doing, we have several appointed positions that are, and elected positions that I agree need to be closely looked at. And I also think that in working with the CAO, we do need to put a formula in place on how the coroner public administrator position is calculated out. Since it is not a traditional department head, we do need to have something that defines exactly how we pay that position.
I would agree.
Is there anything further, Mr.
Those are
Toffenelli?
my, those are my comments right now.
And valued Supervisor Toffenelli, thank you. Miss Marita Calloway.
I don't ever remember anywhere in recent history that we've talked about the electeds. And in fact, the Board of Supervisors gets paid for a part-time position. And I don't know any of us who just work part-time. I think we owe it to the district attorney and the sheriff to address the compensation. That's something that maybe we should have done years ago, but we didn't. And this is where we are today. I think we need to look at all of the appointed and elected department head positions first. I know we're in negotiation. We could discuss this in between negotiations, but we'll just keep changing just keep changing. Oh, well, the contract's up in a year, so let's wait and see. I believe we owe it to the department heads and to the electeds to look at the compensation, and we need to do that first. We always put them to the back, and I don't think that's fair to them. We expect a lot out of them, and they set the pulse. I mean, I understand what Supervisor Stopper's saying, waiting till everybody else, and we'll be at the back of the line. We've been doing that consistently for years, and I think it's time to stop. And I would like to see us, especially the electeds, before people sign up for running for DA or for sheriff or for coroner, they should know what the compensation is. And I think we need to do it for all the others like we just did for the other electeds. I would also like to consider, based on what Ms. Hawkins has said in the past, looking at a step system for the positions. Maybe it's the same as the rest of the county staff, maybe it's different. I'm open to her suggestions.
Thank you, Ms. Calloway. It's appreciated. Ms. Fullendorf.
I think we owe it to them to look into this.
Thank you.
I agree with the point that Supervisor Calloway has made. And if it's not it, I guess my question to Judy, and I don't know if you have this answer, but other than a step system, are there other alternative systems to tie? I believe, and I could be wrong, Amador County ties some of those items to the Superior Judge. I don't know if these positions would qualify for that, but I would be interested to learn if there were options like that outside of the step system as well.
Thank you, Ms. Fullendorf. Mr. Garamendi.
Thank you, Mr. Chair. I'm sad that we didn't take this up. This wasn't part of the whole item we took on with the other electeds and appointeds before. It should have been incorporated in that. That being the case, I'm okay with studying it, but I'd want it to be part of the comprehensive salary survey work that we're doing for the overall campus, for the whole county.
I would concur. There's some points that Ms. Calloway and Ms. Fullendorf did follow up on, and even Mr. Toffenelli. These are in-depth surveys that go into this. I don't feel like with the initial raise to the initial electeds in the first place, that the homework was done substantially to the point that we're gonna hold employees to in the county. I'm not opposed to bringing all these people up to the level that they earn on a daily basis. I say they do substantial work, and I mean, these numbers are significant, but at the same time, you know, they're much behind the significance of what the rest of the world's at. You know, and there's definitely room for us to move forward so that not only do we have qualified people running for office for these positions, like we're fortunate enough to have right now, but in the future, you know, is that worth it for someone that's maybe better at the job than I am to run for that position, you know? And I need to take that into consideration as I move forward. I think that one thing I heard across from all the board members is there's more information to be had. So with all those discussions in it, I really honestly feel that the coroner's been dealt a short hand in this part of the process also. I want to be clear that, you know, there's people out there that do the jobs of coroner that aren't necessarily elected officials that make quite a bit more than $63,000 a year. So with that, I'll entertain a direction from one board member. Seems like we're all over the map, but you know, sometimes one of us picks up on the pulse of the board in its entirety, and we can get something we can all work forward on together. So
I guess I'm going to throw out, listening to what Supervisor Garamendi said and what Ms. Hawkins had said, that it's going to be a year or so before we get through everything. And if that's the case, the people who might sign up for elected positions aren't going to know anything till a year or so from now. I think we owe it, at least we need to not look at this as all or nothing. And I believe we need to somewhat pick out the priority. And I think the priority should be the electeds. That would be the coroner, the DA, the sheriff. And then I think we should look at our department heads. Otherwise, we just keep waiting. I can't believe that the chief probation officer makes what he does. And of course, everyone knows how I felt about planning, but I think we need to set the priority. And for me, the first would be the electeds, and the second would be the department heads, and then all the other many positions fall with how HR wants to do it. The other belief is that, if I remember, and Ms. Hawkins, please step in, that we hire somebody to do the comp survey, indirect, and you could then do the electeds and department heads. How would that fold out?
So currently, we have the electeds and department heads included in the survey. We can pull them out and do them separately if the board so wishes. You know, it's something that having an outside source do the review, then they can dig in a little bit deeper into other sources and information. Especially on a little bit more complicated positions such as the coroner, since it is very unique. But we can definitely, if the board wishes, we can bring forward earlier than the other positions, the elected and department heads. We will have the survey done. It's not going to be quite a year. It'll be less than a year. We will have it before the board prior to recommended budget.
okay, thank you, Ms. Hawkins.
Can I just get a clarification, Mr. Stopper?
Yeah, absolutely, Marita. I was going to try and clarify what direction you're going with and see if the rest of the board had appetite for it. So,
Ms. Hawkins, when you said before recommended budget, the whole thing's going to be done before we go into budget hearings in September?
No, recommended budget is June of,
next year.
Yes.
Oh, okay, so we're talking a long time away. Thank you.
So, if I may, Ms. Callaway, I think I heard a recommendation with you that we move forward on those 3 other elected official positions as a priority, and then the rest follow in line when it comes to our, appointed department heads, and other department heads aren't necessarily appointed as we work forward. Is that pretty much it in summation?
Well, you sort of skirted the line. Yes, for the electeds. I know. I recommend that we set the priorities, we do the electeds. We finish that off. They haven't been done in years. And then we do the department heads.
Okay.
And we do everyone else.
I think we're in a position on this type of item because we'll need to bring this all back and then make a final decision. So I'm going to pull the board on it. I know you don't like polls, Ms. Callaway, but that's the route I'm going. Mr. Toffenelli, do you agree with Ms. Callaway?
I prefer to wait until when we get the whole comprehensive study done and back in June of next year.
You heard Mr. Toffenelli. Ms. Fullendorf.
I think we need to separate it out.
So do you agree with Mr. Toffenelli or do you agree with Ms. Callaway?
Callaway.
Ms. Callaway was Ms. Fullendorf. Mr. Garamendi.
I'll go with Carrie on this.
I also would go with Mr. Toffenelli. I think there's more research to be had. I think we can spend a little more time. By no means do I think that any of the elected officials don't deserve a raise. I think they should have been included in the whole as this moved forward. But at the same time, I've given my reasoning about my position on how to move forward with this, so I think they should be included in the whole. And if the opportunity were to come back, I would send it back to the whole of the board to go along with that, along with the elected official positions that we voted on already. So I think we have a consensus of 3 to go move on to June preliminary budget of 2022 item.
Thank you.
Thank you. We are at a time of 12:15.
Mr. Stopper, Mr. Chair, I do have one question of Judy. In that study, does it include the CAO's position?
We did not, for this particular scope that we were given, we did not look at the county administrator. We did look at Public Works, Health and Human Services, and County Council.
Okay, thank you.
Thank you, Ms. Hawkins. Thank you, staff. I'm going to call for lunch now, unless there's some reason to move on, but it's well into 12:15 right now, and staff needs their lunchtime, so.
We've only got one item left.
You're correct. Okay, is it the consensus of the board to move forward on the single item and then do supervisor's announcements and call it a day? Okay. Aye.
Yes.
Okay. Okay, my apologies for going the opposite direction. Thank you all. You put me in my place. Item 11, resolution. Division of Cannabis Control. Adopt a resolution establishing application fees for cannabis testing and distribution permits.
Good afternoon, Chair Stopper, members of the Board of Supervisors. This item is a item from the Division of Cannabis Control. I'm your director, presenting findings from a fee study that we conducted regarding application fees for testing and distribution permits. We've also included a resolution, and we recommend adoption of the resolution. By way of background, on June 22nd, the board approved an amendment to Chapter 1795 that included testing and distribution. The ordinance became operative on July 23rd, 2021. And generally speaking, there are 4 different types of activity that that amendment allowed, which could be summarized as a general distribution license in M1, 2, and 4, the limited distributor license in the ag zones, a distribution transport only permit, and testing facilities. We've also prepared and included a fee study report, and I'd like to summarize that and go through real quickly what those results were. So this chart presents the general flow of review. So once an application is filed, on the left portion of the diagram, you can see Division of Cannabis Control. This indicates the point where the application is received by us. Very similar to our review under a cultivation permit and modification applications, we conduct a screening review. So this covers basic eligibility criteria, and including setbacks, zoning, parcel type and size. And from that point, once we finish screening an application, it's disseminated to the cooperating departments, the same departments that we're familiar with in our review of cultivation applications, for example, as playing a role in that review process and having the ultimate approval of their specific subject matter areas. Simultaneously, while that review is taking place, to the right of the middle block, you see the Division of Cannabis Control also conducting an in-depth review of operational restrictions on the property, including essentially an operation plan or a business plan that they provide to us that includes things like record keeping and chain of custody requirements, security plans, which we administer and forward on to the Sheriff's Department, as well as lighting issues and things like that. So once all of these departments have approved the review of the application, and we've approved, on the upper right-hand corner you see that the application would at that point be finalized and approved and ready for issuance and validation. So moving down, one of the things that we observed when we conducted our fee study is that there were significant differences between the time commitment to review a general distribution and a testing facility permit application on the one hand, and on the other hand, the limited distributor and transport only license types. They appeared to be very similar in the group, that there would be general distribution and testing facilities being very similar to each other, and the limited distributor and transport only licenses being similar to each other. And that has to do with differences in essentially the footprint or demands on changes to property or the need for facilities between those two groups. So the transport only and limited distributor, they tend to involve a much lesser degree of need in terms of facilities, because they both either have no or limited need to store and house vehicles, and their operational plans are also going to be far more simple than a testing facility and a general distributor who can service multiple other cannabis licensees. So for that reason, in our study of the time requirements, we came to a figure of, for the DCC, $821.70 for the general distributor and testing facility, and for the transport only distributor and limited distributor, it was $457.49. And again, that has to do with what we anticipate will be a lesser degree of the need to examine facilities and operation requirements. And in fact, we anticipate that a majority of the time for the limited distributor, which is a distribution license in the ag zones that can only distribute their own cannabis, a lot of them are going to repurpose existing facilities and alter their site diagrams so that they can accommodate this additional license type. That's not going to be every case, but we think that that's going to generally be more common than not. So for that reason, we've grouped them as presented in these charts and arrived at the time and cost allocations for the DCC that you see in these charts. And for the building department, we expect for it to be very similar. So the main components that the building review's taken in here is an administrative fee of $139 for both groups of license types. And we've included an additional time allotment of 2 hours and 40 minutes for the building department because we expect for general distributors and testing facilities, there will be at least one site inspection. And so we sort of mapped out different locations in the county, tried to arrive at an average travel time and prep time, and then actual time at the premises to arrive at that 2 hours and 40 minutes. In addition, experience has taught us that there's going to be a degree of communication with the building department between them and us, and we've built that into this fee as well to arrive at $647.74 for the building department. An additional note to this is that this is based off of the building department's recent adopted fee study that allows them to have a department-wide personnel cost at $139 an hour, and then this is the total of the hourly rate, or the number of hours that we anticipate every application for general distribution and testing would require. Just like the DCC, these figures are less for the transport-only distribution and the limited distributor. And the portion of this that is the main difference is that we don't expect that in every case the building department is going to have to conduct a site inspection, especially where someone has repurposed existing facilities and their diagrams, business plan do not indicate that they're making substantial or any changes to existing facilities on the premises. And of course, in the case of transport only, the transport only distributor cannot store cannabis. So this is also going to be a very minor change that the building department may look at this and say, there's no change here that requires us to conduct an inspection. But the building department would have the ability to assess additional inspection fees if they determine that another inspection or a inspection is required. And this would also not include any additional permit fees that the building department may impose. And of course, until the building department has seen the application and decided whether additional inspections or permits are needed, they would not greenlight the application and it would not be approved by us until that has occurred. So we think that the structure here will result in a fair and universally applicable fee that has flexibility to adjust to the specific circumstances in each application. The planning department, we expect, will have an administrative fee, review fee of a half hour for the director and 1 hour for the planner too. So the time spent by the planning department tends to be confirming setback requirements and distance from sensitive uses. There are sometimes some special circumstances that require have required me to discuss the particular zoning requirements or a particular setback or sensitive use distance with the planning director. And we've built in a portion of time to be able to have those discussions and collaborate on issues so that the planning department is able to determine whether or not they can approve this application. But these are essentially the basic amounts of time that we have determined the planning department will need to process every application for testing or distribution. EMA is going to be very similar to what we found the results were under the modification study. Some of the things that have changed is that well testing requirements are now going to be time spent instead in examining the adequacy of septic facilities, air filtration, chemical storage thresholds. There's still the Certified Unified Program agency determinations that are made based on any proposed existence of hazardous materials. But this was the fee that we arrived at in consultation with EMA, and that would be an hour and a quarter for the director, an hour and a half for the permit tech 3, and then another hour and a quarter for another permit tech 3. And that's the reason there are 2 permit techs here is that there are 2 different employees who have different subject matter expertise who will be examining these files. And we believe that this is a reasonable estimate based on our past experience working together on other application types. Lastly, Public Works is also going to have an administrative review fee of a half hour, which will enable them to make assessments of any additional permit needs, such as grading or encroachment permit needs. And this would also allow us to have interdepartmental collaboration with them. If there are any issues that we need to discuss, this half hour should give us the amount of time that we need to address those things. So we've built in an administrative fee of a half hour for Public Works in every application. So aggregating these costs, we've brought down the amounts from each of the cooperating departments and the DCC, and together they total $1,784.37 for general distribution and testing facilities, and $980.92. Both of these numbers we've rounded up to $1,785 and $981 respectively. And again, just to recover the point that these are a basic fee that applies in every case, but in the case of building department, for example, they would have the ability to assess additional inspection fees, and of course additional permit fees would apply on an as-needed basis for all of these applications. These numbers are reflected in the resolution that we've included with this item, and I'm happy to address any questions that the board may have or recover any subject in this fee study report.
Thank you, Mr. Whalen. We appreciate your time. Any board questions?
Yes.
Ms. Callaway, good to see you again.
Mr. Whalen, I do not understand why, if you're just distributing, you can't store, why you have to go to the planning department. I mean, I'm having a problem comprehending why everybody needs to touch the application if all someone's doing is driving in, picking up the product and delivering it somewhere. You don't have to look at setbacks. It's not involved. I don't know. What am I missing, Mr. Whalen?
Thank you, Supervisor Callaway. Now, I totally understand the question and the concern. A lot of these, the restrictions and allowed activity that we associate with here under the limited distributor, general distributor, transport only distributor, and testing facility, a lot of these correspond to restrictions that are set by state regulations. So, for example, the distributor general would be a type 11, and they can essentially conduct any activity that distribution generally contemplates. So that would be storage, arranging for testing, collecting taxes, other administrative burdens that they perform. So that's kind of the general distributor. The test or the transport only is additionally, that's based off of restrictions that are set by the state. So our permit types are designed to correspond with existing state regulations, except for the limited distributor, which we have developed for the ag zones and created a restriction that makes it a unique permit type. But we think that it's wise and helpful to have all of these departments engaged, because really all of these permits are going to touch on a subject matter that each of these departments is responsible for. You know, if that can include anything from a small structure that the building department needs to permit for safety features, grading, compaction, etc., to additional location on a premises that may involve grading that the Public Works Department has to look at, or an additional entrance that requires a road. It could be any variety of issues. And so we think that the best approach that I would recommend to the board is to follow the design that we have in place for cultivation, to be able to bring in all of the departments that have subject matter expertise in these areas, and give them a basic administrative review fee to be able to look at the application and say, is there an issue that I see here? That way nothing falls through the cracks.
Well, Mr.
Hope that
Whalen.
answers your question.
No, it doesn't. Why can't, for some of these, if they have to have a state permit to be a distributor. So all we're doing is being redundant to what they have to have. If somebody's is taking their product and taking it somewhere else, they have to have a state license to be that to distribute their own product. Why it needs to go through this whole process with us, or if I'm taking testing off the table, because then we know there'll be a structure, facility. I'm just talking about pickup and delivery, and why we have to go through this process when they already have to have a state license. We confirm they have a state license. Why they just can't. I mean, we have people distributing, bringing product into the county for our dispensaries, and that we don't go through all this. So what difference is it then we take the raw product and delivering it to ABC Manufacturing in Oakland?
So I would say that there are two reasons for that. Number one, even though the state has regulations in place that govern their activities, their physical presence is in our county. Unlike what used to happen, where a distributor would come in from out of county, for example, here we're talking about a physical presence on locations within the county that are going to involve issues like grading, building permits, control over chemical storage, adequacy of facilities, be it water or septic or any other number of issues. So the major difference is that we now have that component that we have to review, which is different than what we used to have because they were just coming into our county and leaving. So so that's one of the key distinctions. And you know, I would also say that it's also a factor of us being able to assure the Board of Supervisors that all of those components of 1795 that the board has enacted are all being met. So it's not just the land use and physical presence piece, but it's also the requirements that are in 1795 that were adopted by the board, that we need this collaboration to be able to assure the board and the public that we are meeting all of those operating restrictions in the code.
If I could follow up on that, part of the state laws provide for the fact that a distributor isn't just a pick up and go drop off at a store. That's never what really happens. They have to store it while it's getting tested to provide that it's safe enough to get to the store. So the facilities that Mr. Whalen is talking to is these storage facilities. Now, someone may have a processing building on their property, but the state law also applies that the whole storage area for the distribution has to be completely separated off from the area that is doing the processing. So those are two state laws that are providing for facilities or buildings that need to be put into our area through building code that need to be inspected. They need to be up to fire standards, and there's multiple aspects of 17.95 they have to live up to. So it's the reality of someone just picking something up and taking it to a store and dropping it off is not one with the state laws as they apply. Am I correct, Mr. Whalen?
Yeah, and I apologize if I, that summarized it very well, and I agree with that.
Except your distribution type 13 can only transport. I mean, they can only transport. They're not going to have a building. They can't store it. They're not going to have a grading permit.
In that case, they are transporting directly to a type 11, which facilitates all those types of things, Ms. Callaway.
And I would add, Supervisor Callaway, that even though they may have a lesser footprint, sometimes very insignificant, because they can't store cannabis, they can't conduct the administrative functions of a Type 11 distributor, but they still have regulations regarding keeping records, developing manifests for shipping, and there's still other aspects of them, even if it's a very modest or insignificant presence that they have. They tend to have space that they occupy where they park their vehicles, things like that. So there is still a regulatory need based on what state regulations and local county code require.
Fine.
Nice try, Ms. Callaway. Any further board comments? If not, I'll send out to public comment. We'll move to public comment.
There is no comment at this time on this item.
Thank you, Ms.
I retract that, I'm sorry. There is a comment for Ms. Smith. I'll allow her to talk now.
Ms. Jennifer Smith, I presume?
Yes.
This is Jennifer Smith. I think we're excited to see that from an industry perspective, we're excited to see this come forward. I think that we're excited that we can have the two different types of distribution and testing. This is going to allow for more jobs in our county. This is going to allow for more commerce and for our product to actually move out of county into retail. I'm excited to finally get this moving forward, and I think the fee study looks reasonable and not terribly onerous, and I'd like to thank you for that.
Thank you, Ms. Smith. I'll bring it back to the board if there's no further public comments.
There is no further public comments.
Thank you, Ms. Glanville. Well, if there's no further comments by any board members, I'll entertain a motion.
So moved.
Thank you, Mr. Garamendi.
Second.
You sure, Ms. Callaway?
Yeah, I'll negotiate later.
Excellent. Mr. Topnelli.
Yes, Mr. Chair.
Aye or nay?
Aye.
Thank you, sir. Ms. Callaway?
Aye.
Mr. Garamendi?
Aye.
Ms. Fullendorf?
Aye.
And I am also an aye. Passes on 5-0 vote of the board. Thank you, Mr. Whalen. We appreciate your time, your homework. I also do want to note that, something that Mr. Toffanelli's brought up in the past is tracking these numbers and making sure we have them right in the future. And Mr. Whalen's implemented that into the system, so we have a fuel tracking so we can verify that everything's costing what it costs and that we're being fully compensated for all the work our staff does moving forward on this. So I just want to say good job, Mr. Whalen. We appreciate all the good work you do.
Thank you, Chair Stopper.
With that, we'll move on to supervisors' announcements. In compliance with Government Code 53232.3D, board members shall provide brief reports on any meetings attended at the expense of the local agency and may make other announcements or report out. Mr. Toffanelli, I'm going to start with you, sir.
Thank you, Mr. Chair. I have a Mountain Valley EMS board meeting this Thursday, and it's kind of an important meeting. I've asked Sarah after this meeting sometime in September that we put this item on the agenda so we can have an open discussion on it. Stanislaus County has sent a letter with their intent to pull out this JPA on June 30th, 2022. And we need to have an open discussion on how we go forward with that. But this meeting coming up is a special meeting dedicated for that. So I will be reporting back in September on that meeting. And that's all I have, Mr. Chair.
Thank you, Mr. Toffanelli. Ms. Callaway. I assume that's, I don't have anything.
Oh, nothing to report. Thank you, Mr. Chair.
Thank you, and thank you for your time today, Ms. Callaway. Mr. Garamendi.
Thank you, Mr. Chair. I'll be brief. RCRC board met on Wednesday. They voted to form a JPA, California Connect, which will be bringing broadband, hopefully, to rural California. That is, we're having another meeting on it on Thursday, and I'm happy to be part of that steering committee, and that item will be coming to this board probably in the next month or so to join the JPA. That's all, sir.
Thank you very much, Mr. Garamendi. We appreciate all the work you do with RCRC and everywhere else you are. Ms. Pollendorf.
I attended the executive COG meeting yesterday, and what I shared with that group, and I want to share with the board members, is last week I was presented an opportunity. I was only going to be meeting with one of the staffers in Tom McClintock's office, and I got a phone call that the chief of staff would be there as well. So I worked with Mia O'Connor and Amber Collins to talking points with the Congressman Chief of Staff regarding the western segment of the Wagon Trail. With the current infrastructure bill on the table, asking for consideration of a letter of support, and also a letter of support to DOT, and all other options for funding opportunities in the future to help get the western segment kicked off. So I just wanted to share that with the board. It was not planned, it just was laid out, and I was in close contact with Mia and Amber through that. Nothing really came out of that other than they would consider a letter in the future for any grant opportunities that the county would be looking at from his office. But I wanted to share that with the rest of the board. Yesterday we also had a strategic planning committee. We supported staff to bring items directly to the Board of Supervisors rather than go through our committee on various items such as animal shelter and a couple other conversations that we've been having. So we thought it was good to bring that back and have a dialogue with the Board of Supervisors rather than our committee. And that is all I have.
Thank you, Ms. Pollendorf, and we appreciate the good work you're doing towards the Wagon Trail and, providing for support for grant funding in the future. It's integral to our success moving forward on the project. I had a CSEDD meeting. So that's the Economic Development District with 5 counties: Mariposa, Tuolumne, Alpine, Amador, Calaveras. A lot of thing that comes up a lot of time is the broadband issue, and I'm working with them so that we can move forward. And a lot of them do attend RCRC with Mr. Garamendi, and I'm and when the times can be, I'm pushing for the direction of the CSEDD to follow the direction of RCRC, so we aren't either replicating work or stepping on each other's toes as we move forward. I think RCRC is a great vessel for all this, for the most part. So I'm willing to follow in that direction. Also, I just want to thank the board. It's been a pleasure working with you all this year. Really feel like we're counseling really well. I just appreciate all the good work you all do. We all have our strong points, and I rely on those. I just want to thank you all. That's all. And that's it. Let's call it a day. Thank you all.
Thank you, guys.